Welcome back and thank you very much for joining us. Time now to look at other developments in the fight against COVID-19. Well, professional health practitioners will have to hit the ground running when providing healthcare during the fight against this pandemic. While there isn't sufficient capital allocation for innovation and no vaccine of the virus, there's a possibility that the already overcrowded public facilities will be gridlocked and the poor functionality of healthcare institutions in townships and rural areas may overwhelm public healthcare. That's when the private sector will have to provide the much needed assistance in solidarity for the country. So let's hear what some companies are doing to help. We're joined by Quinton Zunga, who is the CEO of PR Bophelo. Thank you very much for joining us on our program.
Thank you to Colin, and thank you to your viewers.
All right, before we can speak about how the private sector is helping, has there been an assessment or a feasibility study on how to get on the bandwagon to help the government to fight the pandemic?
Yes, there is. There are a couple of initiatives that are underway. The first one is the Hospital Association of South Africa, STREAM, which has grouped together all private hospitals to coordinate the efforts around mobilizing of PPEs, working together with the government, and also keeping information statistics, which is sent to the NICD, National Institute of Communicable Diseases. So that is a forum that the private hospitals have put together that ensures that there is coordination amongst the parties. Secondly, there are lots of bilateral discussions with the different provinces around the needs of each provinces, and this is mainly talking about the linkages between the private sector and the public sector. I think one of them was the call we had today with the minister, which basically most of the hospital groups that were on the call, everybody agreed to work together. I think there was a sense of unity, a sense of we can get this done together working with the private sector. So very appreciative of that effort and the leadership that is being provided.
So when you compare, the advancement of healthcare in the private sector to or with the public sector, it's, massively slanted. So how is the private sector going to come in so that we can look at how we can just, even the access so that it shouldn't be access to private or public healthcare when it comes to the treatment and the way the country is going to address COVID-19?
That's important, and that's what the minister says, that when it comes to the current situation, it's going to be there's no private and public, there's just healthcare. The key thing here has been, firstly, trying to ascertain how much capacity the private sector has and how much they will avail to the public sector or the government. I think we've been on record that we have 5 facilities that we can put as fully dedicated, and other hospital groups have also chipped in with various sets of commitment. I think what the minister has said is that they're going to look at that on a national basis to try and coordinate and make uniform the needs of all the provinces and the facilities that the private sector can provide. What's important here is that the private sector is saying that the private sector should be open for public patients as well. And that discussion is going to be done under a platform with which the Ministry of Health and led by the minister is going to set uniform rules across the group so that there is a coordinated approach to how to handle. So what the public should be looking forward to is once every protocol is in place, all facilities, both public and private, would be available.
Do we know how much has been set aside by the private sector, especially with HR Bophelo as a JSE listed company? I mean, there would be resources that are needed in terms of coming up with interventions during screening. If there is a possibility of patients influx into public hospitals, provision of things like ventilators and other healthcare resources.
So from our side, we have pledged 300 beds in 5 facilities across 5 different provinces. We know to date from KZN, I think that number was around 700 beds that they have confirmed will be available from the private sector. And on a national specific, I think you get a few thousand beds available for the national public's patients. Now, the key thing is there are different levels of beds that need to be looked at. Firstly, obviously, is your ICU beds. That number drops in what kind of ICU beds. Then you have the availabilities of ventilators you're mentioning. There is also a different statistics about that. So all of that has to be very coordinated, because the sense which the minister was saying is that the lockdown has achieved flattening the curve. And once the lockdown is finished, we are not yet finished with this pandemic, and you could have a second wave, and in which case we should take this 3 weeks to prepare ourselves so that should that demand come, we are all ready.
All right. Thank you very much for making time.
Thank you so much for having me.
Right, that's Quinton Zunga, who is a CEO of RH Bophelo, a JSE-listed company which is 100% black-owned, and talking about the contribution of the private sector in fighting the pandemic.